Hi, everyone. Thank you all for joining. This is a webinar from the Global Observatory of Long-Term Care. Specifically, this webinar is organized by the Care and Social Protection in Southern Africa Special Interest Group. Adelina Comas-Herrera is the director of the observatory, but unfortunately she isn't able to attend today. So my name is Naz, and I work as a research coordinator at the GOLTC, and we'll be doing a quick introduction for the observatory. The GOLTC is an initiative of the International Long-Term Care Policy Network. The idea behind the observatory is to harness the collaboration that many of us had through long-term care COVID and now focus on tackling wider long-term care challenges. The aims of the platform are to be for cross-national learning, so to identify key shared challenges and showcase how different countries and localities are addressing them, and to share evidence and facilitate collaboration. This is an area that is open to anyone interested in long-term care. That includes policymakers, people with industry backgrounds, advocates, care professionals, and academics. So membership for the GoLTC is free, and I'll be sharing links in the chat during the webinar as there are many ways to engage with the observatory, including sharing publications, country profiles, and joining special interest groups. In terms of our next big event, we are having the Day of Care and Support, the UN's International Day of Care and Support, on Friday, the 28th of November. And this is a 12-hour-long webinar, starting off with our partners in Australia, and I believe closing off with our partners in Chile. We have quite a few webinars from other special interest groups for all of November and December, and I will share the links for that in the chat as well. And now I will, if you want to join the GoLTC, you can scan this QR code. But now I will pass it over to the Care and Social Protection in Southern Africa Special Interest Group to begin their webinar.
Thanks, Naz, and thanks everyone for turning up on a Friday afternoon or lunchtime or morning, wherever you are based. My name is Professor Adelina Moore. I'm here based at the Family Caregiving Programme at the University of Cape Town. We started up this special interest group thinking around older persons' care and social protection, particularly on the continent or in the region of Southern Africa. Today, I'm very excited to have this talk today. We're going to think more about older persons' disabilities and social protection. We have three speakers. I myself will be speaking on some work we've been doing over the last year or so on a particular social protection system called the Grant in Aid. And then I'm joined by Dr. Anne Kamu from the University of Nairobi in Kenya, who's been doing quite a lot of work on older persons and NCDs, and she'll be telling us more about that shortly. And we're also joined by Commissioner Molo from the National Development Planning Authority here in South Africa. So each of us will talk for about 10 to 15 minutes, and then we will open it up to questions. We should hopefully, I think we will only have an hour for this session, so we'll have at least 15, 20 minutes for talk and discussion at the end. So that said, I'm going to share my slides and start the first presentation. And just give me a minute to do that. Thanks. Okay, I'm gonna make sure everyone can see the slide. Can you all see? Yeah?
Yes, it's just not, oh, perfect.
Okay, great. So I'm gonna move this, sorry. So here in the Family Caregiving Programme, we started hearing a lot about, in our work with older persons and families, we started hearing about what's called the Grant in Aid, a social grant in South Africa geared towards and targeted towards older persons who are living, quote unquote, in regular need of assistance, right? But imagine I told you that this grant was available for older persons, has been available for older persons for post-independence or beyond, actually from the early 40s onwards. But actually, and it's as I said, targeted for older persons living with disabilities, but the application process is really disabling. And very few people know about the grant. So this is what we discovered in 2023 when we were doing our work on family care of older persons with 100 families across the country. We started hearing about this grant and people talking about it and the difficulties they had in either receiving it or finding out about it. So we decided, well, we needed to know more about this particular grant, And we also needed to find out what would it take to actually get it, and why do so few people, older persons, get it. Now, as I said, this grant is a form of social protection for older person grant beneficiaries. So older persons in South Africa who already receive the older person grant, which is about 75% of the older person population here in South Africa. It's kind of a supplementary grant for those who are, quote unquote, as the legislation says, in regular need of assistance. So in thinking around this particular grant, we wanted to see, well, if we were to imagine how many people should be getting this grant, we need to think about care needs and measuring, levels of impairment, as it's called, or forms of how would we know how many older persons in South Africa who are in regular need of assistance. And there's different measurements for that. So, for example, if you look at, general household surveys, you ask specific questions around older persons having difficulty seeing or walking or talking, for example, or dressing. We see that about 1 in 4 older persons have difficulty seeing, 1 in 4 older persons have difficulties walking. Other evidence suggests that the number of older persons who need assistance with at least one basic activity of daily living, such as walking, eating, dressing, is around 40%. Well, it goes between 38% and 49% in specific regions. So these are the kinds of estimates we were playing around with on the one hand. So saying this, well, this is really the kind of physical impairment. What about the built environment? We could see through our work on the ground that it's very difficult for an older person who has some mobility challenge, to be able to go outside to use the bathroom when the bathroom is only outside, because they need to go up and down steps, traverse over a rocky road potentially, and they may need assistance with that. So the built environment for us was an area, in addition to things like collecting water or the level of electricity available in the country for older persons. These were other parts to understanding care needs and the number of people who would require care. If you don't have access to water in your house, you're probably going to need assistance in getting water from a family member. But at the very lowest level, if we were to think 40% of older persons would require care or would be in regular need of assistance with a basic activity of daily living, we'd say that's about 1.5 million older persons in South Africa. But we could see that 1.5 million people were not getting this grant. We could see that nationally, if you look at the map here of South Africa, and if you look at the green right at the bottom, we could see that about 7% of older persons were getting the grant, which is very, very low. 7% of older person grant beneficiaries. Now, I have to say these are figures from 2022. Already in 2025, in June, I'm happy to say that figure has jumped up to about a 12%. So there has been some changes over the last 2 or 3 years, which I'll talk about. So that's one thing. We could see that the receipt was very low, or the uptake was very low, but we could also see that there was interesting provincial differences. South Africa is divided here into 9 provinces, and in different provinces, so for example, in KwaZulu-Natal, the uptake or the receipt was much higher. It was at 11%. And we weren't sure what would inform those differences, what would explain the differences in the receipt of this grant. So we decided we need to do more work to understand the nuances of this grant. And the work that we need to do needs to take different methods. We can look at national figures. We can look at reports that are written at a national level about receipt of this grant. We can, investigate different systems of finding out about this grant through the national hotline. But there's lots of things happening at a provincial level that we need to also consider. So we attended various initiatives that were province specific. And we spoke to government officials working at a provincial level in implementing this grant at the South African Social Security Agency. We also worked with our 100 households, and we asked our 100 households about whether they knew about this grant, whether they'd interacted with it, they'd applied for it. If so, why? If not, why not, for example. And because we could see that at the very least, 40% of 40 households out of 100 would be probably eligible. The older person would probably be eligible for this grant. So we decided based on that, where a lot of people either thought it was too difficult to apply for or they hadn't heard about it, we said, well, why don't we undertake an ethnographic study where we support older persons who we think are most likely eligible to apply for this grant? And so that's what we did. We started off with about 40 older persons, but in the end, we assisted 15 older persons in accessing that grant. And that we did across the different areas we work with in South Africa. So we worked both in the Western Cape, which is on the bottom left of your screen, in about 4 different sites in and around Cape Town. And then we worked up in KwaZulu-Natal to get a sense of these provincial differences that may be occurring and that we wanted to kind of explore further. And essentially, as I said, we wanted to think about, well, why is it so difficult to not only apply for, but to receive? And we felt, whilst the numbers could tell us one thing about differences, we really had to be on the ground and apply for this ourselves with the older persons to get a real sense. And so we found quite distinct differences and kind of explanations of why the receipt of this disability grant for older persons, the grant in aid, was possibly very low. And the first major thing we found was that we discovered that this process of applying for the grant involved at the very least 5 steps in the Western Province. That's the area in where Cape Town is. So the steps are outlined here. I'm not going to go into the detail of all of them, but an older person, either alone or with a family member or with our help in this particular case, was expected to seek information about when they could apply, then physically, that also encountered often going to the local office, then apply by going to the local office, then get medically assessed for this particular grant and aid, and then go back a 4th time to undertake and obtain some papers that they could, complete, and then they had to go back a 5th time to submit all of this. So this was incredibly time-consuming. It was very onerous physically, cognitively, mentally, psychologically, on older persons and their family members who were obviously in need of full-time care. So we argued that at the very least this would take, and this is a very conservative measure, at least 40 hours in applying for this particular grant. And it could cost anywhere between 1,000 Rand and 2,000 Rand, depending on where you lived and whether you were rural based, or depending on how much money you had to spend to be able to get private transport. But most importantly, what we also found along the way, that whilst in an ideal world, it took 5 steps, in reality, it took about maybe 7 or 8 steps, as many pieces of information that was required or steps along the way were complicated by either errors undertaken at the medical assessment level, or maybe at the earlier stages, or at a clinic level, for example, or extra demands were placed on specific applicants for additional information. Now, it must be said that the paperwork and bureaucratic administration or requirements was over and above what was needed. Because, as I said at the beginning, all the people applying for this particular grant are already on the system. All their data, all the marriage certificates, their bank statements, etc., are already on the system, and they were being made to do this again. In addition to that, they were actually being asked to navigate 5 different institutions, which are all obviously physically located in different places. Sometimes these offices are not in your community. You have to go to the next kind of larger town, for example, to be able to access them. So needless to say, this is incredibly onerous, costly, and exhausting. The good news is that we saw in one of the provinces in KZN, we saw a slightly more streamlined version of the process. We saw that there had been reforms, or at least some thinking in how the Social Security Office here in South Africa could make this more age-friendly and more enabling for older persons living with disabilities. And they had a kind of a 4-step system, which, albeit still relatively onerous, it was less onerous than other parts of the country. And we could see that this was happening. They called it the grant and aid drives, where they would have somewhat of although it's not a one-stop shop, a multiple stop shop for older persons, that they could go to the one place, albeit for multiple steps. Now, this was incredibly beneficial, and this sparked off our attention because, as I showed you earlier, there were certain provincial differences in the number of people receiving this grant. And these types of initiatives were potentially causing an increase in people being able to apply and as a result, get the grant. And this is highly encouraging. So there is good news, in the various practices and programs that are at play. All of this speaks to, obviously, needless to say, questions around older persons and older persons living with disabilities, their right to social security, which we know are enshrined in both national law and international law. We saw this the current system as it was being depicted either in the Western Province or in KZN as a real violation to older persons who are living with disabilities to live independently. That's both in contradiction to the Older Persons Act of 2006, at a national level, but also international law, which has been ratified by South Africa, the Convention on the Rights of People with Disabilities, and their ability to live independently. All of these onerous programs or onerous steps that they had to encounter to be able to apply for the grant, let alone receive the grant. Now, the good news is that we put our findings into a report, and we published the report late last year. And we decided that, well, let's try and work with the South African Social Security Agency and try and support how this may be better streamlined or better, how it can be improved. And so in our report and in our findings and what we presented to both national and provincial level kind of Social Security Office in South Africa, SASSA as they're called locally, we suggested a whole range of recommendations that could be done quite easily and with low cost, and other kind of suggestions that might take more time. And so I'm happy to say, and that my colleagues and I are involved now in a task team with SASSA, the Social Security South African agency here in the South African Social Security Agency, sorry, in here. And we're working to try and see and piloting a reformed mechanism of applying for this particular grant. But at the very least, what we said was there are kind of three levels at which things can change. There are ways in which we can improve awareness and make sure we're displaying and disseminating the correct information. And these kinds of mechanisms and steps can be taken straight away. Changing the website that is available, changing the information on the website, because a lot of it is wrong. We could also have other, what appears to be kind of minor changes, such as having a wheelchair available on the days that older persons apply for this particular grant. We could have a different queuing system on those days. We could also have a commissioner of oath available on those days. All of these steps would make the process far more enabling. At a kind of a second level, we also said, well, we need to be clear and consistent across provinces and local offices about whether family members are able to apply on behalf of older persons, and whether this three-step process that's kind of available in KZN, or three-step process, and whether that should be kind of streamlined, or whether that should be carried out across other provinces. And that's something we're looking into, as I said, at a provincial level here with our task team and our colleagues at SASSA. So there's a whole bunch of kind of suggestions we were making. At the very least, and obviously at a more national level, we wanted to make sure that all unfair treatment and discrimination of older persons living with disabilities are removed from this process. So through this review of the grant and aid, we were making these suggestions. One of the things that is a bit more complicated and challenging to tackle in the short term is the way in which the assessment is carried out, and the way in which a doctor or a medical professional gets is assessing what exactly in regular need of assistance means. And that's a bit more complicated and involved in wider systems of assessing disability in the country here in South Africa. So not only in relation to this particular grant, the grant and aid, but also to the disability grant. So we're hoping that whilst our task team at the moment is operating at a provincial level, that we can widen it to other provinces and to see what's happening. At the moment, we don't really know what's happening in other provinces in relation to the process of applying for this grant. And all we can do is track the numbers and the receipt of this grant and see that things possibly are changing. Thank you. Okay, so that's kind of strange to be the chair and the presenter at the same time. So apologies for the strange two hats that I'm wearing today. I'm going to hand over now to Dr. Kamu, our colleague from University of Nairobi. Dr. Kamu, are you able to share your slides? Thanks.
Thank you. And thanks to everyone, and good afternoon or good morning where you are. My name is Anne Kamau. I'm a sociologist from the University of Nairobi, and I'm based at the Institute for Development Studies, and also from the African Research Universities Alliance Center of Excellence for Non-Communicable Diseases. And it's a pleasure for me to be here. So I'm going to talk about disabilities, older persons, social protection in Kenya. And I may not focus too much on the disability components. I will try to focus a bit on the older persons and link that to the social protection context in Kenya, drawing from experience from a project that we are currently implementing that is funded by the IDLC and Global Affairs Canada on scaling care innovations in Africa. And our project is on caring for the caregivers. And our aim is to develop a national policy for caregivers of persons living with non-communicable diseases. Now, in terms of really understanding why this is important, and especially for the older persons, is that across Africa and including Kenya, we know that the aging population is rising. And in Kenya, we have a increasingly higher and increasing older population that is estimated to be 6% of the overall population at about 2.74 million. But again, largely growing, and that is a population of 60 years and above. And what we know and from the research and even government documents is that there's a rising burden of chronic illnesses and disability among older persons, as much as there's also the increase in NCDs or non-communicable diseases across all age populations. But the older persons are more affected by chronic illnesses and disability, particularly, and therefore, because we also know that there's persistent infectious diseases, therefore then there's a double burden. And therefore, there's high multimorbidity, again, among this population group, in addition to having NCDs like hypertension, diabetes, cancer, cardiovascular, and musculoskeletal conditions. And in Kenya, the NCDs account for about 39% of deaths annually and are projected to rise to about 55% by 2030. And we know, even from the research, as we did the research, and I'm going to show you later, is that NCDs or non-communicable diseases due to disability, they contribute to early aging, loss of productivity, and also disproportionately affect the poorer and older populations. And of course, this also has implications on there's functional decline, and there's increased dependency, and even persons who are aged 60 plus having to depend on long-term care. And there's also, of course, socioeconomic vulnerability. But also to note this early point that other than them being in need of long-term care, from our research, where we find that they're also caregivers, and therefore there's even perhaps a triple burden of just being having the challenges, but also having to take care of others. Now, so as I present, I will try to draw to bring the discussion to how disability, aging, and social protection intersect, and what does this mean for inclusive policy, and especially for social policy, and in our case, within the care economy, what does it mean when you have to recognize, redistribute care work, and especially among this population. And it's also based on the understanding that there's generation of intergenerational care norms and extended family safety nets. Therefore, more and more old persons are finding themselves taking care of themselves or taking care of each other as older persons. And you'll see that also from the presentation. And already I mentioned that I'm drawing insights from our project, which is aimed at developing a national policy for caregivers of persons living with non-communicable diseases. And it's based on survey data that we collected this year in February 2026. And while it didn't necessarily cover the old persons, what I've done is that I've isolated this data and removed the data that is not for the 18 to 59 years and just focusing on the older persons, either as care recipients or as care providers in this context. Now, in terms of definitions, in Kenya, the term older persons is officially defined both in national and policy and registration. And we have the Older Persons Act of 2024, and also the bill supporting the same, which defines an old person as someone who has attained the age of 60 years. Therefore, anyone 60 years and above is considered to be an older person. And this is also in line with the African Union Policy Framework and Plan of Action on Aging 2002 and the UN Principles for Older Persons 1991. As I present, there are some more other additional definitions which I consider to be important. One is care, because it has quite a bit to do with what I'm going to talk about. which is about physical, psychological, social, material assistance to an old person, including services to promote quality of life and general well-being. And this partly also falls within the social protection framing. And then the caregiver, and this is, in this context, for me, is a 60-year-old plus person, is any individual organization that provides care to an old person. And also there's a frail older person. This is an old person in need of 24-hour care due to physical or mental condition, hence incapable of caring for himself or herself. And then home is a place where old persons reside alone or with a family member. And then home-based care also, which is critical, is care of services provided by a caregiver at home of an old person to maintain the old person's level of comfort and dignity. And it does not include care provided in residential facility. And also there's respite care, which is part of what we found to be common also, is a provision of temporary care and relief to an old person by a caregiver. So I'll be coming back and forth to those terminologies. So in terms of the policy framework for older persons in Kenya, we have our Constitution 2010, and in Article 57, it recognizes the rights of older persons, that is 60 years plus, to live in dignity, receive reasonable care, and participate in community life. You note here that it does not actually include them taking care of others. So that is one key gap that I note as I progress. Then National Social Protection Policy 2011 revised in 2023, it also identifies older persons and persons with disabilities as key target groups. And of course, the social led by the National Social Protection Secretariat, there have been programs that have been rolled out nationally targeting older persons, and I'm coming to those ones shortly. And then you have the Older Persons Act and Bill, from which I've drawn the definition, which establishes in Article 25(1) a cash transfer program for older persons in need of social assistance, also linked to the National Social Protection Policy. And then you have the Kenya National NCD Strategy 2021 to 2025, which again informs this work, focusing on NCDs, and the strategy draws from a life course approach, covering all ages, and it emphasizes equity, universal coverage, and non-discrimination, and acknowledges aging populations and the demographic transition through. However, it is not explicit on the focus on old persons. And then in terms of observation, the National Social Protection Policy and the NCD strategy both recognize old persons' vulnerability, but however, they tend to operate not in tandem, but in silos. And for example, the strategy is not really explicit, even though it's focusing on the life course in terms of how does it focus on the older person 60 plus. And I think this presentation is really important for us, because even for us, perhaps we would also have fallen into the same trap. So in Kenya, we've had, in terms of social protection for older persons, it has been a long journey, starting from 2007 through the Old Persons Cash Transfer, or the OPCT, under the Inua Jamii, what's called the Inua Jamii program, which ran between 2007 to 2014. And this program targeted poor and vulnerable older persons aged 65 years and above. It was household-based, meaning only one eligible member of a household would benefit, meaning even if there were 2 or 3 older persons, only one of them from the household would benefit. And in total, by the time the program ended in 2014, the coverage was about 310,000 households in total. And mainly the objective was provide income support to the poorest older person. So again, it was targeted, it was selective, and really not covering, the coverage was very narrow. But however, after the 2014 phase, there was a lag between 2014 and 2017, but in between, the Kenyan team visited Brazil to learn to benchmark with the Brazil model of the older persons. And in 2017, a national universal program of older persons was rolled out in 2017, and which is universal coverage, and it's for the 70 years and above, meaning anybody, so long as you're 70 years, you are eligible to join the program. And it is demand driven, so long as one registers in the program, and therefore they can enroll. Of course, there are periods within which enrollment is not taking place, like now. Normally it's announced, so there's normally that gap in terms of there could be someone 72-year-old but not yet in the program because of lack of continuity in terms of registration. And then the coverage is about 1.3 million registered old persons right now. One has to reside in Kenya and also not be on another pension program to benefit on this cash transfer program for the 70 years plus old persons cash transfer program. And I think this is just to repeat what I've just said. So I will not spend too much time on that again, because just repeating the same. Now, in terms of when now we combine with the non-communicable diseases, the policy statement is that older persons are entitled to safe human treatment, protection, and respect. And this also has to do with access to health services that meet their specific needs, and also assurance that they are never left without necessary medical care. But again, this is something we find that it does not necessarily happen as it is indicated there. So, and one thing to note is that Kenya has two levels of governance. We have the national governance structure and the county level or sub-county level governance structure. And for health, where now again, if you're to put these older persons with the NCDR is a devolved function, but the two pre-complementary roles. And while the national government directs policy and provides standards, develops standards and in all of that, at the subnational level, they're more involved in direct service provision. Therefore, old persons then will interact more with the subnational governments in terms of getting access to services, enrollment, ensuring enrollment in the programs. They depend more on the county level or support systems. And also, they also allocate resources for programs and interventions. So any programs and interventions, then the subnational levels would support. Now, I'll try to draw, based on what I've said now, some of the results that we're getting from our work is that overall, when we did the study, we found in terms of age category, you can see that the 70, I'm not sure if this data is adding up. But again, if you look just at the bus, I think this is not sure if it's percentage of frequency, but I would need to check again. Yeah, but the population of the care, the 60 to 69 in terms of those who are caregivers and those who are care recipients, you can see more older people are care recipients, and quite a number, also about 12% also the 70 and above, who now will be under the cash transfer program, also caregivers. But also you notice the 60 to 69, you see the 16.3% are caregivers and 20.5% are care recipients. So it means that quite a considerable population, almost 30% of older persons, 60 and above, are caregivers, and at the same time, of course, are care recipients. And also, in terms of when you look at the data, the average caregiving duration is about 12 years, ranging from taking care of individuals between 1 year and 53. So, but again, it means that as care recipients, some have really lived on with their illness conditions. And also, that means also if they're being taken care of by the person they're living with, who in this case might also be the 60 and above, then it means it's a very long duration of being under care. And again, when you look at the 60 and above in terms of who they're taking care of, most of them are taking care of their spouses, their children or a parent, or other relatives within the family. And also most of the care, now going back to the home-based care, takes place at the care recipient home. So the person being taken care of. And for a small percent, about 5% in the care in the caregiver's home, if this is not like the spouse. So that means that as much as we are thinking about social protection of older persons, we also really need to think about is the money that they receive, because they receive 2,000 so after every 2 months they get 4,000. Is that adequate enough for them to take care of themselves as older persons, and also to take care of the people they're taking care of, some of who may be living in long-term conditions, especially non-communicable diseases, which can be quite costly to manage? I'm not sure if my timing is correct. It seems to have gone off.
Hi, Anne.
So
Hi, Anne. Sorry, I don't want to interrupt. You've got 3 minutes left, but
Oh,
I'm not sure what
good.
slide you're on.
Yeah, I'm almost done. So again, in terms of any form of disability, both the care recipients and the caregivers, the 60 plus, somehow said of course they have illnesses and disability. Most of it is either loss of mobility, fatigue, and weakness. And again, it means when it comes to social protection, we also need to look at the benefit value and ask ourselves, is it really, whether it's loss of mobility or fatigue and weakness, are they able to, is a social protection, the benefit value actually adequate to take care of them? And then in terms of some of the programs they're able to access and they're aware about, mostly is a cash transfer program, the 70 plus. We have the new social health insurance fund, again, but not so many of them are enrolled. And there was departure from the previous National Hospital Insurance Fund, which had complementary program for older persons. But the current program, apart from now the 70 plus, it removed the complementary package. Therefore, if now the old persons have to go to hospital, they pay for themselves or they have to join another program. So I think I will skip this so that I conclude. So in terms of observations, is that the shift from to the new, there's been a shift in terms of even the payments to digitalization or the mobile money platforms, which have both positive and negative impacts. However, there have been registration challenges with some old people not even being able to access the money now they're supposed to get. If, for example, they don't have the phone or they're not able to operate it or they have other conditions. Again, like already mentioned, the complementary program, there's a lot of uncertainty. Previously, there was additional money for health insurance coverage, but now removed. Again, like also mentioned, many older persons provide unpaid care work, and this adds additional financial burden and constraints that really we need to think about. And even if they had the social protection or cash transfer, the benefits vary, as I already mentioned, then would are irregular in many cases and also may not be adequate to support the old person's cash transfer program. So we need to ask then, within this context, what should really happen to older persons who are providing family caregiving with persons living non-communicable diseases, either themselves as caregivers or themselves as care recipients? And thank you very much. Thanks, and back to you, Adelina.
Thanks, Anne. Thanks, Dr. Kamu there. That was a very insightful, and I know a lot of work you've been doing on the work on NCDs in Kenya, and then not exclusive to older persons, but a large portion of obviously looks at older person care and elder care in that regard. I am going to hand over now to Commissioner Molo. Just for everyone in the room, Commissioner Molo is joining us from the National Development Planning Authority here in South Africa. Hi, Commissioner. I'm going to hand over to you now to present your piece. Thanks.
Thanks, Elena, and good afternoon, everyone, and good morning as well. I'm not sure if you need me to turn my camera on or not, but am I audible enough?
You're audible. It's fine. Whatever suits you. Thanks,
Okay.
Commissioner.
Thank you very much. You know, from a National Planning Commission, let me just say that this is such valuable work that's being done, particularly around elderly persons. And it's an area of work that we haven't really focused on as the National Planning Commission, largely because it's not specifically addressed in the National Development Plan. So as the National Planning Commission, we are custodians of the National Development Plan. The National Development Plan came into effect in 2012, and we are the third installment of the National Planning Commission appointed in 2021. Issues around elderly persons and persons with disabilities and women are really addressed as cross-cutting issues in the National Development Plan. So there are no standalone chapters as such that address, I suppose, what we would call vulnerable groups. So what I'm going to be focusing on today is elderly persons and persons with disabilities from the perspective of social protection, which is addressed in Chapter 11 of the National Development Plan. So this is really where we see a specific focus on the provision of care for elderly persons and persons with disabilities. The report that I'm going to also be referring to today is one that we compiled in 2023 as the Commission, after doing a review of all the indicators and targets in the National Development Plan to see how much progress had been made nationally to meet some of these targets. So the report is available on the website of the National Planning Commission. It's called the Report on Monitoring the National Development Plan Indicators and Targets, and we published it in December 2023. And so, as I mentioned, there are no specific or there are no individual chapters that deal with either elderly persons or persons with disabilities. But I suppose there is mention of elderly persons and people with disabilities in terms of addressing vulnerable groups under health, in terms of addressing employment for elderly persons, looking at care facilities for elderly persons or home care, and then also addressing vulnerable groups under justice, crime, and prevention. So each of these areas have their own chapters, and there's mention of elderly persons and persons with disabilities in these various chapters, but there's no real detail, and there certainly isn't comprehensive coverage. When we look at the tracking of indicators and targets dealing with elderly persons, you'll see there that there are no real indicators as such or no real targets as such. So this is a clear gap that we're going to need to have to address going forward. If we look at the next slide, which is a table that I've drawn from the report, this deals mainly with the grants that are afforded to persons with disabilities and elder persons. Just to note that, unfortunately, in my view, it is unfortunate that one can't qualify for both grants. So if you are an elderly person with a disability, you are not necessarily going to get both grants by virtue of the fact that you have a disability. So if you've been receiving a disability grant all along as a young person, when you do reach the age of 65, you don't necessarily qualify for an elderly person's grant because you've been receiving a disability grant, and vice versa. If you happen to incur a disability as an older person, you're not necessarily going to get a disability grant. I think that is a gap, because I think the idea of the grant is to try and cushion maybe or address the challenges that come with being an elderly person, or the challenges that come with being a person with a disability. And they don't cancel each other out, those challenges. You can have challenges that are multi-layered. And unfortunately, the grant system in the country at the moment doesn't address that. So the report looks at progress that has been made in terms of paying grants for persons with disabilities, for elderly persons, for military veterans, etc. As you can see there in the table, the progress that's been made since the since the creation of the National Development Plan in 2012. So it's just over 10 years ago. It's almost 12 years now. So you can see there that some progress has been made year on year. The target, I think, to have all elderly persons receiving a grant by 2020 was set at 100% by 2020. And it seems that has been met. What's interesting to me about that is that when we look at persons with disabilities who are who qualify to receive a disability grant, there has been a decrease since COVID. There's been a decrease in the number of grant recipients. I don't quite know the reason for that. We've tried to establish precisely what the reason for that is. We suspect it might be as a result of people falling out of the system during COVID and never really going back, or as a result of maybe people's temporary disabilities having been addressed, and therefore they no longer qualify for the grant. Because obviously, if a disability is no longer regarded as a disability, then one can't really qualify anymore for the disability grant. It is also a bit controversial in my view, because we rely on medical experts to determine whether a person has a disability. And I think we know that we've progressed from the medical model of determining disability to a more social model of disability. And so there are a lot of gaps. The professor that spoke just before me spoke about the fact that NCDs cause a lot of disabilities as well. And we know that in South Africa, NCDs are on the rise. In fact, they are the leading cause of deaths now in the country. But unfortunately, there are a lot of impairments resulting from NCDs and malnutrition, for example, that are not necessarily considered as disabilities yet. So that is a bit of a problem. Yeah, but just in terms of the targets in the National Development Plan, the indication is that we are on track in terms of meeting the payment of grants to elderly persons. But I think that there's still a lot more accommodation that needs to be afforded persons, elderly persons. So I think that's going to have to be looked at in the next installment of the National Development Plan. The National Development Plan expires in 2030. So we are trying to ensure that we make as much progress as possible to meeting the current indicators and the current targets in the National Development Plan by 2030. Having said that, though, we have already started the work of looking beyond 2030. So we are starting to work on diagnostics for the next National Development Plan beyond 2030, whether we call that National Development Plan 2 or Plus or whatever it will be called. And so in my view, doing the work of the next development plan, we really are going to have to consider whether we want to have a targeted approach to elderly persons and persons with disabilities, or whether we want to focus on mainstreaming. Now, mainstreaming is very popular. That's certainly what the white paper on disability advocates. That's certainly what a lot of interest groups advocate. I'm not entirely sure about the idea of mainstreaming, because so far it hasn't really worked in the country. It hasn't really achieved this ideal of leaving no one behind. People are left out of the budgeting, as an example, because the idea is, well, we're mainstreaming. So if you're addressing women's issues, for example, then you're addressing by default all women. I think we all intuitively understand that that's not necessarily the case. I think that a more targeted approach can work, and it doesn't have to cancel out the idea of mainstreaming. I think that when we look at inclusionary programs, we can learn from programs that have worked internationally, but also from programs that have worked locally. So I speak often about starting with the most vulnerable in society. If we start planning for and budgeting for the most vulnerable in society, whether they're children, whether they're persons with disabilities, or whether they're elderly persons, then surely everybody else will be catered for. That's how we ensure that no one gets left behind. A local example that has worked very well is the expanded public works program, the EPWP. That program was actually created for persons with disabilities in South Africa. That is a work program, casual work program that was started, was it 2018? I think it was. And initially it was targeted at people with disabilities. And it has now been expanded to include all people who are needing work. As I say, it's casual based work, but it's paid for work. This is, I suppose, in many respects, a program that is similar to the idea of the curb cut effect, which we know is an international approach towards inclusion. And I think that if we adopt the curb cut approach here in South Africa for both persons with disabilities and elderly persons, then we have no chance of leaving anyone behind. I think that that's one way of ensuring that we have addressed all vulnerable groups, and that the catchment is such that it can then be expanded to include people who are traditionally left behind, whether they are people in remote areas, minority groups, indigenous people, etc. I think that we have to have that kind of holistic approach. I think that we also have to consider that elderly persons are not rendered useless by the fact that they become old. They still want to be economically active, and we need to look at how it is that we continue to consider persons that are elderly as being able to make an economic contribution, and being able to make sure that there is financial inclusion for persons that are elder. There should be financial products for them beyond the SASSA grant. I don't think that by virtue of the fact that a person turns 60 years old, they are no longer interested in making money or in receiving money. So those are issues that I think that the National Development Plan is going to have to consider beyond 2030. And obviously, when we're talking about elderly persons, we need to look at the caregivers of elderly persons. We are aware that there are many challenges around persons who take care of elderly persons and persons who take care of disabled persons, because they themselves are not necessarily taken care of. They are not included in the budgeting. So I think there just needs to be a more holistic approach, a more comprehensive approach to how we address elderly persons and persons with disabilities. And I think that we'll be better able to do that if we look at a more targeted approach towards elderly persons and persons with disabilities. But that doesn't mean that they shouldn't be mainstreamed. This is not an idea around excluding persons in any way, shape, or form. It is the exact opposite. As I said, I am a big advocate for the curb cuts effect, and I think that that will work very well. We are going to be having a disability roundtable next year, looking at how we're going to be addressing disability beyond 2030 in the National Development Plan. And I think that will also be a useful platform for us to discuss elderly persons. Actually, elderly persons make up the majority of people with disabilities anyway. So by default, we should be discussing, I think, persons with disabilities and elderly persons in the same vein, I guess. And yeah, that is really it. And I'm happy to take any questions. Thank you very much. Elena, back to you.
Thanks, Commissioner Mullo. Thanks so much for the contribution. Very excited to hear about the next installment of the NDP and the roundtable next year. There is lots on the cards and scope, as you said, for taking both a targeted but also a inclusive approach in planning and visionary strategy for the country. I'm going to now open up for questions. So you can either turn on your camera or raise your hand or just kind of shout out, whatever is your preference. And to pose questions to any of the three speakers, including myself. So feel free. I'll give people a minute, or you can post it in the chat if it's easier, and I can read it out loud for those who may not be able to, if your connection doesn't warrant it or whatever. I think there's Roseanne. Are you? Would you like to comment?
Yeah, thank you. Yeah, thank you very much. I'm sorry, I couldn't find my hand, so I couldn't raise it.
No worries, go ahead. It's okay.
And I'm very grateful to listen to this. I must apologize. I think I missed the first presentation and I missed just a part of Dr. Ann Kamau's presentation. My name is Roseanne Jiru from Kenya. Elena, we met in Johannesburg a few weeks ago. And to the others in this webinar, good afternoon. It's good evening in Kenya. Thank you, Anne, for the presentation that you have made. Both Anne and I are working on the same project on developing a national policy for caregivers of people who take care of persons with uncommunicable diseases. And I thank her for trying to tease out some of the data for elderly persons. So because then I have listened to Commissioner Molo's question, I'm just going to say that I am very impressed also that I think we have convergence in terms of thinking about including caregivers and elderly caregivers for this specific webinar within the social protection architecture for our countries, and that's very good. Anne mentioned that in Kenya, the cash transfer for elderly persons is so little. 2,000 Kenya shillings is less than 200 USD per person. And these persons who receive this money have so many other expenses and are perhaps caregivers themselves who have to take care of sick persons using just that same amount of money and take care of themselves. I was just wondering whether in South Africa, and maybe out of ignorance, how is the cash transfer, and is it adequate, or is it something that you've got to keep on advocating for to ensure that we cushion elderly persons against this vulnerability? And I think question number 2, as you think about the national protection, you call it the national protection plan, the next national protection plan, is there a way of thinking about then how we have, and I'm very happy and delighted to hear Commissioner talk about the targeted versus mainstreaming, but is there a way also to think about how the policy coherence where you integrate aging and disability and social protection, under one unified long-term strategy instead of working in silos? And Anne Kamau also highlighted the same, that we really have a problem of policy siloing. So then we end up not really being very targeted, and therefore not also being able to have very targeted indicators and measures to be able to track progress. So 2 questions. Thank you.
Thanks, Roseanne. And lovely to hear from you again.
Thank you.
I can attend to the first question. Perhaps I'll hand over the second question to Commissioner, if that's okay. So the first question about the social protection forms in South Africa in comparison to Kenya, I presume. And if I don't know if you were asking specifically for older person. I think one of the big differences with South Africa is that the specific things for older persons, obviously, but then there is many other forms of social protection for other groups in society, whether that's foster children, whether that's children, whether that's people living with disabilities who are not yet 60 plus. Even, for example, the grant in aid that I presented on is a supplementary grant for people who are over 60, who are living with a disability. So there is that kind of, there's also a social relief distress grant, albeit temporary still, for able-bodied working-age adults who, you know, it's a very small sum and it is temporary. So there's a number of social protection mechanisms that come together in households, you know, and are pooled in households, so that, you know, and I don't know the figures, I've forgotten the figures off the top of my head, but something like, I think it's maybe over half of the population households are covered by social protection in some version or other, you know, so there's quite a range, and therefore it's considered at times generous. Albeit that said, clearly the values of each individual support, it can be questioned. So needless to say, the child support grant is below the poverty line, for example, for children, or the food poverty line specifically. There's calls for that to be amended constantly. You know, similarly for the older persons, it is generous, quote unquote, you know, however, when you do any costings on the real cost of living, it barely covers food, let alone other necessities such as electricity, transport, particularly for people living with disabilities who have higher costs of transport. So it's not covering the real cost of living, and it's by no means giving people a dignified life if you're you know, if you're still food insecure or water insecure or energy insecure. So, I mean, I think the main difference, I suspect, between South Africa and other countries is the number of social grants available in any one household, and not just the value of them too. But I'll hand over to Commissioner perhaps to attend to the second question, Commissioner, if you're able to.
Thank you, Adelina, and thank you, Roseanne, for the question. So, so the National Development Plan is the country's long-term strategic plan. And so as the National Planning Commission, as I said, we are custodians of the plan, but we are not implementers. We provide advice to the president and the government around issues drawn specifically from the National Development Plan. So we are looking at what it is that can be more effective going forward, whether it's around disability, whether it's around elderly persons, and whether the best way of addressing that is to have a more integrated approach. So as I mentioned, we are looking at a diagnostic exercise at the moment, which we will hopefully then be able to workshop through with various stakeholders and see what the best approach going forward would be. As I said, because we are not really implementers, we also need to understand how the policymakers themselves view what it is that we are trying to address around social protection. So Chapter 11, which is the social protection chapter, draws a lot on international laws, but as we know, we don't have a standard definition in South Africa around the social protection floor. So we have been workshopping and working with other stakeholders around the social protection floor, for example. And I think that once we have a defined social protection floor in South Africa, it will be easier to then have a more integrated approach towards elderly persons and disabled persons from both a targeting and mainstreaming approach. So I mean, I would agree with you that the idea is to ensure that everyone is in the loop, but you know, we have to also avoid avoid mainstreaming to the detriment of others. So as we look at the National Development Plan beyond 2030, I think it is going to be critical to either, you know, to look at whether we address disability as a chapter on its own, and then elderly persons on a chapter on their own. Even the question around the youth, there is no specific chapter dealing with youth in the NDPI. The youth is also considered a cross-cutter. So we have all these really important members of society, groupings of society, that are not really addressed as such in the National Development Plan. So it's absolutely imperative that we look at a more holistic approach and a more targeted approach going forward.
Thanks, Commissioner. I hope, thanks, Roseanne, for the question.
Thank you very
Folks,
much. Very well answered. Thank you.
Thanks. I don't see any hands up. I mean, Nas, can you see anything in the chat? No. Oh.
Were we able to read the one from Wambui?
I can't see. Unfortunately, my chat's not working properly. I'm only
That's
seeing.
okay. I can read it. So
Okay.
it says, my interest is in supporting caregivers of people with dementia. My question is on qualification of people with dementia as people with disability, ensure they benefit from social protection mechanisms, both in South Africa and Kenya.
Yeah.
And
That's-
then go ahead. And then the second one is from Hannah, and it goes, question, is there a framework for similar social protections for OPs in sub-Saharan countries where aging is not yet an issue, but is likely to be in the future?
Okay, well, I can attend to that. Hannah's first. I mean, Hannah, there is, I mean, aging is an issue in all of Southern African countries. You know, you have 1 million older persons in Malawi, for example. It might be small percentages of the population relative to other, maybe higher income countries or other parts of the world. But they, on average, you know, older persons represent from 5 to 10% of the population across Southern Africa, obviously variation across each country. So each country is at different stages of the policy development, you know, where South Africa, for example, obviously has legislation, it has policy specific plans, strategies, all the rest. Botswana is something similar. They're finalizing their particular framework currently is under review, but it's only like maybe months or so away. So there is a lot of policy work currently taking place, where each country is at slightly different stages, but also learning from each other and other countries that have gone through this process. Kenya, for example, you've just seen they've got, if I'm not mistaken, you know, legislation coming up for caregivers, which is, you know, worlds ahead in thinking, and is really, really progressive and exciting. Just, I'm going to pass over to Dr. Camu in a second, but just on relation to the other question and the question in relation to whether people living with dementia qualify as older persons living with a disability. And I mean, that all depends, I suspect, you know, I'm not sure if you saw the presentation, but the medical assessments done in relation to the grant and aid. So older persons who are, you know, who are already in receipt of an older person grant beneficiary. So that would be the first question. Is that person who is living with dementia already in receipt of an older person grant beneficiary? If so, they can obviously apply for the grant and aid, which is that supplementary grant. They'll be deemed eligible if they are, quote unquote, in regular need of assistance. That is assessed mainly on physical attributes and cognitive too, and not necessarily on, you know, where you live or how you live or the built environment, which is something we obviously query. But cognitive assessment would, needless to say, definitely be considered. And essentially it is a review of that person, their file, their medical file. So depending on possibly depending on the stage of dementia for that older person, they'd be more than likely to qualify. So it is available there. It's just, you know, I'm not the assessor. I'm not the, you know, literally the doctor making the assessments, and I don't know at which point they would argue that someone living with dementia is in regular need of assistance. And it's something we do query and we are raising with SASA. But as I said earlier, it's part of a much larger debate that Commissioner Molo also raised about how we're understanding disability, and by no means through a medical model only. But perhaps I can pass over Dr. Camu. I don't know if you want to speak to the frameworks for social protection for older persons in Kenya or beyond in Southern Africa.
I'm sorry, Elena, I dropped off, power went off and I got off, so I didn't get the question. If you could just help me to.
Yeah, sure, no worries. There's a question from Hannah. Is there a framework for similar social protections for older persons in sub-Saharan countries where aging is not yet an issue, but it's likely to be? So I just gave a response, but I don't know if you want to give a response from Kenya, what's happening, or from anywhere.
Yeah, I think the Kenyan context is we have quite a number of social protection programs where, I hope I'm responding to the question correctly because I had dropped off, where an old person can benefit from. For example, if someone has person with severe disability, of course, then they can enroll in that program. But then there's an old person's cash transfer program. If in our context, like if they're caregivers and also they have a child perhaps who is considered to be an orphan and vulnerable child, then from the caregiving perspective, then that burden can be lifted in a way if the child again gets cover. But ordinarily, they wouldn't give, you wouldn't get like the one for old person's cash transfer and then also get for persons with severe disability. So there are quite a number. Most of them run from the social services. And if for us, for example, from the health sector, is that we are gaining entry now into, from the now health side, into the social protection space. And already at the moment, we have the Kenya Care Policy, which is generally anything that is called care is what is under that policy. But it doesn't really go into the real issues of addressing what are the real issues of the persons with disability or old persons. And as a requirement from the 2024 Act that I mentioned, is that the government, or what they call the secretary, who is now the custodian of the policies from the social protection side, is supposed to ensure there's registration of the recipients and also their caregivers. But again, we know that is not happening. So what we have then at the subnational level, and I may give an example of one county where we are also working in, which is Murang'a County, is that they have now started a county level also social protection program, mainly focusing on healthcare for old persons. But it's general, but again, in some, it's mainly the target is also because of NCDs, you find more old people enrolling into the program. But again, it is in one county. Some other counties are having it. So these are county level initiatives parallel to the national level initiatives. But again, unless there is really goodwill and good support from the county leader, then that does not happen across the country. So again, there are those parallels, some parallel, some just complementing. So that's the kind of situation that we are in Kenya. Thank you.
Thanks, Anne. So thanks for that, Hannah. I don't see any other hands or questions in the chat. I can now see the chat again. Apologies for that. I don't know. I think we may be coming to an end. Does anyone have any last burning questions or comments? If not, I want to, if I don't see a hand, I'm going to thank Commissioner Molo and Dr. Kamu for their time and all their insights. I'm really grateful for all that, for the support with this webinar and for thinking across countries and also different actors in society. You know, we want to make sure that all voices are heard in these webinars, and I really appreciate that. And thanks for NAS and the GOLTC team for facilitating this. I really appreciate that too. And if that's, I don't see any hands. I think we can call it a day on this Friday evening here and probably later in Kenya. So thanks everybody.
Elena, from me, perhaps just also to say thank you very much. And we really would be glad to be part of the GOLTC. Perhaps my colleague Roseanne next time can do the presentation, and we can also get from our side to also be part of this. We're really grateful for this, and we hope to be permanent members. Thank you very much.
Brilliant. Thank you so much. Thanks, everybody. Bye-bye.
Thank you, Elena. Thank you,
Thanks,
everyone.
Christian.
Bye.
Thanks, bye. Bye-bye.
Thank you. Bye. Bye.